Hey guys, this is Dr. Hub. Today we are going to look at the CTEV and its procedures. So to begin with, we start with months. So under months, we look at from 6 to 12 months period, what is the procedure which we commonly do. So it is known as the turquoise posteromedial release. So it is known as the turquoise PM. We are writing it as PM, that is the posteromedial release. So what is the feature in this? So the feature is nothing but there is a mild CTEV. So there is mild CTEV and there is no severe internal rotation. So in this case there is no severe internal rotation. No severe IR, that is internal rotation, deformity of the calcaneus. No severe IR deformity. And this is of the calcaneus. So this was in terms of the 6 to 12 months. It was a turquoise posteromedial release. Next, when we move on to 12 to 36 months, that is 1 to 3 years. So here the procedure is known as the McKay's. So McKay's procedure. So in terms of McKay's procedure, it is the feature the same as the turco. In addition, there's a lateral sutures are also released. So here the lateral sutures, these are something known as the lateral sutures. This is released. Next we move on to the years. That is in longer duration of periods, that is greater than 5 years. So in terms of greater than 5 years, there is a procedure known as a metatarsal osteotomy. There is metatarsal osteotomy. So in such case, the feature is that there is a metatarsus adductus. There is metatarsus adductus. Then moving on to the 3 to 10 years. 3 to 10 years. So in such cases, there is Dyer's procedure. So in the Dyer's procedure, there is a lateral closed wedge osteotomy of the calcaneus. Lateral closed wedge osteotomy of the calcaneus. Next we move on to the Dillwyn. So we move on to the Dillwyn Evans procedure. So in terms of the Dillwyn Evans procedure, it is the resection and the arthrodesis of the calcocuboid joint. It is nothing but the resection. So there is a resection as well as the arthrodesis. This resection and the arthrodesis, and this is of the calcaneocuboid joint, of the calcaneocuboid joint. Then at 10 we have the Davis procedure. Next in line is the Davis procedure. So in terms of the Davis procedure, there is a wedge resection is from the mid-tarsal area. So the wedge resection, this is nothing but from the mid-tarsal area, tarsal area. So previously in Dillwyn Evans procedure, it was the resection and the arthrodesis of the calcocuboid joint. In Dyer's procedure, it was a lateral closed wedge osteotomy of the calcaneus. Now we move on to in terms of age group, that is greater than 10 years. So if the age group is greater than 10 years, what is present? So if it is greater than 10 years, it is nothing but the triple arthrodesis. It is nothing but the triple arthrodesis. So triple arthrodesis is nothing but in terms of the uncorrected clubfoot in children with age greater than 10. So it is uncorrected clubfoot. So in such cases, it is a triple arthrodesis, that is the procedure done. To learn and grow daily like this, please do subscribe.